Malaysia has reported its first 2 COVID-19 deaths.
Malaysia has placed several residential areas around the Kuala Lumpur wholesale market under complete lockdown.
Malaysia has recorded a total of 2,626 COVID-19 positive cases.
Over here in Asia, China has imposed a partial lockdown on some new regions after some COVID-19 infections spread.
Assalamualaikum everyone and good evening. Let me introduce myself first. Me, Umi, will be your moderator for today's forum. So, welcome to our forum program everyone. This forum program will discuss about a big issue and controversial related to pandemic COVID-19. So, do not waste our time. Now I will introduce our panel. We have 11 panels altogether from Bachelor of Optometry final year students. They are Miss Shamira, Miss Nasrin, Miss Alia, Miss Dana, Miss Hana, Miss Kasturi, Miss Darshini, Miss Shaza, Mr. Shakirin, Miss Joey, and Miss Nelly. So, today's topic will be acute follicular conjunctivitis related to COVID-19. Without further ado, let me start with panel number 1. So, Miss Shamira, can you explain a little bit about this issue and regarding to our topic today?
Okay, since December 2019, COVID-19 has become a global pandemic caused by highly transmissible severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. So there have been several reports of eye redness and irritation in COVID-19 patients, both based on personal account and research of fact, suggesting that the viral conjunctivitis, which is acute follicular conjunctivitis, may be an ocular manifestation of SARS-CoV-2 infection in humans. Okay, so acute follicular conjunctivitis is an acute catarrhal conjunctivitis associated with marked follicular hyperplasia, especially of the lower fornix and lower palpebral conjunctiva, and it is caused by viral. So the symptom, burning and redness in the eye, especially in the evening, feeling of heat and dryness on the lid margin, difficulty in keeping the eye open, feeling of sleepiness and tiredness in the eye, mild chronic redness in the eye, and also mild mucoid discharge, especially in the canthus, off and on lacrimation. So there's one of the signs of acute follicular conjunctivitis, which is conjunctival hyperemia associated with multiple follicle, more prominent in lower lid than the upper lid. So the treatment is topical antiviral drugs.
Thank you, Ms. Chamira, for that opinion and explanation. So now we have known that the virus COVID-19 not only affect the respiratory system, but also may lead to viral conjunctivitis associated with follicular hyperplasia. Okay, next I would like to welcome Ms. Nasrin and Ms. Alia as the second and third panel to present to us the patient's history of this interesting case. Alright, Ms. Nasrin and Ms. Alia, the floor is yours.
Okay, thank you, Ms. Umi. So going through patient general health history, the patient is 30 years old male, presented to a local hospital in Shenzhen, China on 4th February of 2019. On the first day of illness, which is before he came to the hospital, the patient complains with symptoms of sore throat and diarrhea. He also claimed to have a history of close contact with a COVID-19 patient from 28th to 30th January of 2020. His medical history was unremarkable and physical examination was normal. There were 2 tests that has been done, which is swab test and CT scan, and the patient was then discharged from to home for self-isolation. On the next week's of visit, which is on his 6th day of illness, the swab test showed positive SARS-CoV-2, and the patient was then admitted to an airborne infection isolation ward in hospital which is only designated for COVID-19 patient in Shenzhen. On the next day, which is on his 7th day of illness, the swab tests were then tested again and still positive SARS-CoV-2. And the patient also stated that the sore throat and diarrhea symptoms had gradually improved. On the following visit, which is on 30th, 17th and 19th day of illness, the patient only came for to repeat SARS-CoV-2 testing with other kind of techniques besides nasopharyngeal swabs, which is sputum and saliva specimens also. Okay, moving on to Alia.
Okay, so we're moving on to the ocular history. So according to the patient, there was no history of ocular problems or ocular surgery before, and the patient is not a contact lens wearer. So on the 30th day of illness, which is the day 8 of hospitalization, there was no blurred of vision reported, but there are symptoms of redness on both eyes, foreign body sensation on both eyes, and tearing on both eyes as well. So on 15 days of illness, which is day 10 of hospitalization, there was no more tearing, and the foreign body sensation has been reduced, and there was no tender preauricular lymph nodes and reduced redness. And on day 11 of hospitalization, no more ocular discomfort and only mild redness reported. And lastly, on day 14 of hospitalization, all the ocular symptoms has resolved. So we're moving on. Okay, so this is the timeline of systemic and ocular symptom, which is the figure showing the timeline according to day of illness and the day of hospitalization, starting from 28th of January to 18th February. So Nasrin want to explain more on the timeline of the systemic and ocular symptoms.
Okay, as you can see, for the symptoms of his general head, which is sore throat and diarrhea, it only happens on the first day of illness until the 7th day of illness, which is until day 2 of hospitalization. These symptoms reduce maybe because of the prescription of Umi-Favoy, which has been taken by the patient every 3 days. And for body temperature, it shows decrease of body temperature, which is still in normal range. And there are also ocular symptoms that has been stated and other medication taken by the patient.
Thank you, Ms. Nasrin and Ms. Alia, for the good information shared. Okay, everyone. Seems like the patient history shows the complaints are lessened day by day, which shows a good improvement. Let's move to our 4th and 5th panel. So, Ms. Dana and Ms. Hannah, may I know what are the ocular assessments that has been run to examine this patient? And my second question is, what are the precautions taken by the examiner according to the guidelines provided by the Association of Malaysian Optometrists, AMO?
Thank you, Ms. Umi. Coming to the assessment that have been done to this patient, according to the examination that been carried out, the visual acuity of the patient on the right eye is 660, while for the left eye is 612. And the spectacle, this patient is a spectacle multifocal wearer also, but in this when he been admitted in the hospital, he only bought these glasses, which is the power of -2, and 0.75 at 80, and the left eye, the power with the power of -3 and 7.5 with a still power of 100 at the 90 degrees. And when we do the refraction, there are no improvement with any lenses. And while we examining the slit lamp, we can see a bilateral moderate conjunctivitis injection, inferior palpebral conjunctivitis follicle, and palpebral lymph nodes. Then when we search for some subconjunctival hemorrhage, fortunately there are no subconjunctival hemorrhage, no anterior chamber inflammation, and no corneal lesion. And while we do fundus camera and also OCT, reveal a normal finding. Okay, on the first picture we can see some conjunctival injection that can be viewed in these cases. And the second picture on the B picture shows that inferior palpebral conjunctivitis follicle. I can see the patient is having a moderate follicle also can be seen. And the third picture is revealing palpebral lymph nodes. Okay, from this picture we can see picture number A and B reveals a conjunctival injection and the inferior palpebral conjunctival follicle that you see at the early stage of this patient. And number B picture and C reveal after the follow-up from after giving some medication, and C and F, the picture of C and F reveal a fully recovered of this patient. So next, I would like to pass to Dana for further.
Thank you, speaker. Thank you, Hannah. So now I would like to explain about the guidelines that provided by the Association of Malaysian Optometrists, which to guide the optometrists in Malaysia on certain procedures and the safety for both the optometrists and also the patients. So as we know, the Association of Malaysian Optometrists have given a guidelines for optometric practices during COVID-19 pandemic. A thorough instructions have been given from the procedure to the operational all day until the proper way of handling patient while examination. Especially in this case, we are going to see on the guided way of examining patients, which are first, optometrists must wear personal protective gears such as face masks and gloves while attending the patient. Second, always maintain a social distancing and minimum physical contact during examination. Okay, open and close the doors for patient to minimize the patient contacts on the door handles. Fourth, we always must sanitize our hands before conducting any close contact examination such as measuring pupillary distance. Optometrists should well plan the assessment and try to reduce the duration of examination if possible, and explain all the clinical management in a distance which is not too close to the patient, which is while maintaining the social distance. Then the seventh, use as many disposable equipments if possible, such as tissue papers, cotton buds, so that we don't have a skin-to-skin contact with the patient. And be aware of patients who come in with conjunctivitis, because it's one of the presenting signs of COVID-19. So when we have a patient with the signs of conjunctivitis, we always must make sure that both the patient and also the optometrist who's handling the patient are well protected from each other, and also sanitize all the equipments and tools that are going to be used and that have already been used on the patient, so that when it move on to another patient, the tools that we use does not contaminated by any kind of virus or any kind of bacteria and so on. That's all from us. Thank you.
Thank you, Ms. Dana and Ms. Hannah, for your concise explanation. So now we have known that this eye condition shows several clinical signs under slit lamp examination, and we can see a significant difference before and after the treatment. So now we proceed to the next panel. Ms. Darshini and Ms. Kasturi, can you explain what are the management or treatment that has been taken on this patient in order to resolve the sign and symptom experienced by the patient? And of course, we want to know what is the diagnosis of this case.
Okay, moving on to the diagnosis part. Okay, patient is diagnosed with bilateral acute viral follicular conjunctivitis that links with COVID-19. It is said so because this patient had severe acute respiratory coronavirus 2 in a short form of SARS-CoV-2 infection that present during active infection of the conjunctiva, resulting in a acute follicular conjunctivitis. This diagnosis is supported by the conjunctival swabs, which is tested positive on a reverse transcription polymerase chain reaction, which is known as RT-PCR for SARS-CoV-2. And the picture below, we can see that's our collection of the conjunctival swabs is done. Okay, as for the treatment part, okay, first and foremost, it is said that if conjunctivitis is unilateral and sticky, it would be reasonable to consider topical antibiotics such as chlorophenicol drops 4 times daily for 4 days. But in case it is a bilateral conjunctivitis with watery, it's more likely to viral, and symptomatic treatment with a regular hygiene and artificial tears is recommended as initial treatment. But in this case, after the beginning treatment with various medications including umifenovir, lopinavir and ritonavir showed its vital signs stabilized. And the further treatment will be explained by my partner Kasturi.
Okay, thank you to the panel. And then then the patient was prescribed ribavirin eye drops and showed a decrease in conjunctival viral load on day 17. Eye drops like ribavirin treat virus-induced condition, and in this case, it could help to treat the symptoms of viral conjunctivitis. As conjunctivitis is one of the presenting signs of COVID-19, it is important to treat the underlying problems. If in case the patient is having fever, dry cough, shortness of breath or chest pain, treatment should be prioritized for this. However, healthcare workers need to be cautious and take precaution steps when treating the patient by wearing full personal protective equipment, PPE, including protective eyewear, gloves, sanitizing hands frequently, and disinfect the room after the departure of patient. So, most importantly, slit lamp should be covered with shield in order to avoid viral transmission when using it. When follow-up was necessary, it needs to be done by telemedicine consultation. Patient with significant visual impairment should be referred directly to the definitive ophthalmology care. This is implemented to conserve PPE and reduce patient travel in community.
Thank you, Ms. Darshni and Ms. Katri, for your wise explanation. As we know, the amount of COVID-19 patients already hit nearly 8,000 people in Malaysia today. Of course, very important for everyone to know what are the symptoms, prevalence, the co-management, and who are at risk so that they are more aware. So, I would like to invite our next 3 panels, Ms. Shaza, Mr. Shakirin, and Ms. Joy to elaborate on this priority.
So, I will proceed about the discussions. So, for my part is sign and symptoms. So, basically the sign is follicle appear as grey, white, round to oval elevations 0.5 to 1.5 mm. Smaller follicles may produce a slightly irregular and velvety appearance. The follicles can be seen in the inferior and superior tarsal conjunctiva, less often on bulbar or limbal conjunctiva. Next, the symptoms is hyperemia or redness, chemosis, watery discharge or tearing, photophobia, and periorbital pain or also foreign body sensations. So, this is the photo from the patients as mentioned by Farhana during the assessment previously. So from the SLotometry, from the slit lamp examinations, shows evidence of acute viral conjunctivitis. The examination on illness, day 13 show moderate follicle conjunctival injections and inferior palpebral conjunctival follicles from the figure A and figure D.
Right, moving on to the prevalence of conjunctivitis, as an optometrist, it's very crucial for us to remember that conjunctivitis is actually a common condition of the eye, and it's actually happening and occurs worldwide. basically it affect all ages and social status, doesn't matter whether you're rich or poor, and currently affecting more than 2% of entire populations in this world. So looking at the prevalence of the conjunctivitis in Malaysia itself, this is a study. According to a study conducted by University of Malaya Medical Center in 2008, conjunctivitis is the number of prevalence is quite high, especially viral conjunctivitis. But as of today case discussion, which is the follicular conjunctivitis, it's make up about 2% of entire Malaysian. So that is quite high, quite common if we take it as a whole case of conjunctivitis. Next is risk factors of conjunctivitis. These are the factors that might causing the conjunctivitis to the patient. They might come to you and complain that they have red eyes, so you have to be careful on the history taking. The first one is the exposure to something for which you have an allergy. It can be you yourself or the patient. As we know, we also have a different type of conjunctivitis. So this is specifically for the allergic conjunctivitis. So you have to be very attentive to ensure the type of conjunctivitis so that you can provide a better or specific treatment. Second is exposure to someone infected with the viral or bacterial form of conjunctivitis. A viral infections or bacterial infection, conjunctivitis is highly contagious. So make sure you prepare yourself so that you not get infected. And next is using the contact lens itself, especially extended wear lenses. So this will cause conjunctivitis, some kind of irritation to the eye, and also exposure to chemical will also lead to conjunctivitis. So make sure as an optometrist you have the correct history taking so that you can rule out which cases is which one, so you can provide a better treatment for the specific case. So moving on to the next presenter, Joey.
So here we will justify the management and co-management that was mentioned in the diagnosis and management part. So because the patient is suspected to have contract COVID-19 before they actually made the test, so of course the first step is to isolate the patient to reduce transmission. This is done for all transmissible diseases, especially in this time. And the next one is, as they mentioned, is the ribavirin eye drops to treat the symptoms. And because the conjunctivitis is only secondary disease following the main disease, so we have to treat the underlying disease first, which is COVID-19. And after that, of course, the most important is personal hygiene, in which the caretakers and the patient itself are not required to touch their own face, and they have to frequently wash their hands. So we can move on to the next section.
Thank you to all the three panels for the informative discussion just now. So I hope the people will now more aware regarding this issue, and if they experience this eye condition, they will know what is going on. Last but not least, I would like to invite our last panel for today's forum, Ms. Neely, to conclude our topic today.
Okay, thank you, Ms. Umi. So I will conclude what the panel had said just now. So the SARS-CoV-2, or better known as COVID-19, in human can lead to death, and on the ocular surface, it is capable of causing unwanted ocular complications such as conjunctivitis, or more specific follicular conjunctivitis, like this case. Precautionary measures are required to identify whether the conjunctivitis are linked to COVID-19 or not. So a thorough examination on patient must be done correctly. However, the COVID-19 virus in conjunctival sampling might not appear initially, and therefore we need to monitor the condition from time to time until it is proven negative. And at the meantime, of course, the patient must quarantine themselves and avoid contact from other individuals. And in the meantime, we must practice good hygiene, practice social distancing among others, and last but not least, always wear a face mask when going out in public.
Thank you, Ms. Haley, and to all the panels for the informative and interesting talk. Now we came to the end part of our forum. Hopefully the forum will be beneficial for everybody. Thank you for your attention. Assalamualaikum and good evening, everyone.